Today I have my patient Kaya here to talk to us about her previous experience in our office. So Kaya originally saw me for a planned reconstructive jaw surgery. She was seeing an orthodontist and they were going to recommend moving both the jaws, and her teeth were really well aligned when I saw her. So I asked her about eating and her function, and things were pretty good, but she really didn't like the appearance of her chin. That was her main concern, especially cosmetically. It was really recessed. So I started talking to Kaya. I said, you don't have to go through jaw surgery completely just to cosmetically fix the chin. It was recessed enough that I didn't feel like an implant would work in her case. We were looking at maybe moving the chin forward 8 or 9 millimeters. So I talked to Kaya, and I kind of talked her into removing the braces and just going forward with the chin surgery. And she took the braces off, and orthodontist, of course, was really disappointed that he wasn't going to finish the case. But what's your experience been about this whole thing, about deciding to go, not having the jaw surgery, the chin surgery only, and then how you're able to function and chew today?
I mean, it was the best decision that I could have ever made. I mean, I'm extremely happy. My jaw is extremely functional. I'm extremely confident. I mean, I would 100% recommend it. I mean, he definitely chose the best way to go for me, and I'm extremely happy with the results.
So we didn't have to go through like I do the reconstructive surgery, and the patients are admitted in the hospital, and there's quite a bit of swelling for a couple of days, and the recovery's certainly much more than an office-based procedure. So we elected to do the chin surgery, and were you able to eat soon after the chin surgery? What was your experience with the eating?
The first 2 days I was a little nervous just because I didn't know how much I can handle, but after the first week I was eating everything that I could eat. I mean, I didn't really have any problems. I think it was more of a fear, like I was gonna rip any incisions or anything, but I could eat normally. Everything seemed pretty fine, so.
And then as far as swelling and pain go, how would you rate the swelling and pain after the surgery?
The swelling was pretty intimidating for me for the most part, but after a couple weeks went down, I mean, I trusted the process. Everything kind of shaped up as much as I wanted it to. It was a little bit numb the first couple weeks, so I was a little bit nervous, but all of my little nerves started coming together after about like 3 weeks, so I'm happy with that.
So let's just show you where we ended up. I'm going to Kaya turn towards me a little bit, and we're going to have you pull your hair behind your ear. And what I want you to see is the difference in the chin projection. So we really were just going for mandibular chin projection, and so we want to have a little bit of convexity to the profile, which means that your chin should be a little bit behind your nose, kind of in line with your forehead. And where she was just really deficient. So we moved her forward 9 millimeters and gained that amount of space. And in some patients, I'll do this procedure, and they're so deficient that they still need a chin implant. So in a few cases, we've had to come back for patients who needed 15 millimeters of forward advancement, and we've placed a chin implant. Usually I place it about 6 months after the genioplasty procedure. So this was a sliding genioplasty. We do it in the office under sedation. Usually takes about 45 minutes. There's a plate and some screws in there, and she can't feel them at all, and they'll never come out. They'll never need to come out.
I've tried to feel them too, and I can't.
Anyway, we're so happy to have Kaya come in today and talk to us about her experience with the genioplasty procedures. It's one of our favorite procedures to do in my practice.